Surgery isn't the only option, and for some patients it's not even an option on the table depending on underlying health when dealing with knee pain, and not everybody wants a knee replacement. There fortunately are a few other procedures that can be done before that, but what I wanted to talk to you about today was specifically something performed by a special type of radiologist called an interventional radiologist. First, a little background on knee pain. The reality is that in the country and worldwide that nearly half of people experience knee pain at some point in their life, and obviously it gets more prevalent with age, but we know that arthritis counts for about 80% of all knee pain, particularly in the U.S. for adults that are 45 and older, and this just goes up. It seems to affect women more often than men, but I think that varies depending on what scenario you're looking at. That aside, there is a procedure called a geniculate artery embolization, which is GAE. It sounds fancy. I don't want you to worry about the language, so to speak. I want to simplify it down for you. So, whenever you move, walk, squat, kneel, the knees have to bend and straighten, and there's cartilage between the joint spaces, which we're all aware of. This wears away with time due to injury, overuse, excessive weight that we're carrying around. A variety of things can lead to painful knees, which isn't a whole lot of fun, particularly if it's limiting lifestyle, recreation, and for a lot of people, as they get into retirement, the golden years aren't so golden. They can be pretty much brown. What this procedure does is basically there is a small structure called the geniculate arteries, and these arteries carry blood flow to the knee itself. And during arthritic conditions, these arteries can carry a lot of inflammation or inflammatory cells, or bad guys, if you will, inside them, and this causes pain. It's almost like starting a fire in your knee. This is the body's normal response to dealing with injury or illness is oftentimes inflammation. And so during this procedure, the specialized radiologist, the interventional radiologist, will work to stop these bad guys from blocking your way for movement. They'll use little substances called embolic agents, which you could think of as gel or glue or something like that, basically trying to prevent the bad guys, the inflammatory cells, from reaching the knee. And by doing so, they can reduce the inflammation and put out the proverbial fire in the knee, which can help reduce the arthritic pain. So that's a very simplistic overview of this procedure, but it is another tool in the belt, particularly for those who want to remain active and aren't so keen on rushing right into a knee replacement. Joint replacements have a finite lifespan. Fortunately, the technology, including 3D printing and bespoke designs, if you will, are making massive headways right now. There's a company that's trialing cadaver-based knee replacement studies and has, I think, slated later this year a first live human remote performed knee replacement. So there is a lot on the horizon, and it's nice to know that patients don't have to give up hope. It's not necessarily going to make you a better golfer, but at least getting back out on the course, that's just half the battle. Take care. Be well.